Welcome. Today we'll delve into a rare and complex neurological condition, autoimmune dystonia. This video will explore its causes, symptoms, diagnosis, management. Autoimmune dystonia is a fascinating, albeit challenging, area of neuroimmunology, and understanding it is crucial for both patients and medical professionals. The precise causes of autoimmune dystonia are still under investigation, but the core issue lies in a dysfunctional immune system. Instead of protecting the body, the immune system mistakenly attacks healthy brain cells, specifically those within the basal ganglia. The basal ganglia are critical for motor control, so damage to this area is what produces the movement disorder. Researchers are investigating various triggers, including infections, genetic predispositions, and environmental factors that may initiate this autoimmune response. Some cases are linked to specific antibodies targeting neuronal proteins, but in many others, the precise trigger remains unknown, making diagnosis and treatment all the more challenging. In autoimmune dystonia, the rogue immune system produces antibodies or immune cells that target the basal ganglia. This attack leads to inflammation and damage within these crucial brain structures. The damage disrupts the delicate balance of neurotransmitters, particularly dopamine and acetylcholine, which are essential for smooth and coordinated movement. This neurotransmitter imbalance causes neurons to fire abnormally, resulting in involuntary muscle contractions, abnormal postures, and the characteristic movements of dystonia. The specific mechanisms of immune-mediated damage are still being researched, with focus on identifying the exact targets and pathways involved in the autoimmune assault. Autoimmune dystonia is considered a rare disease, and precise epidemiological data are lacking. It is challenging to determine the exact prevalence and incidence because many cases may be misdiagnosed or go undiagnosed due to the variability of symptoms and the lack of specific diagnostic markers. It can affect individuals of any age, gender, or ethnicity. However, it is believed to be more prevalent in individuals with other autoimmune conditions or a family history of autoimmune disorders. Ongoing research and improved diagnostic methods are crucial to better understand the true scope and distribution of this condition. The signs and symptoms of autoimmune dystonia can vary widely from person to person, reflecting the heterogeneity of the immune system's attack. The hallmark symptom is dystonia, characterized by involuntary muscle contractions that lead to repetitive movements, abnormal postures, or both. These contractions can affect any part of the body, including the neck, torticollis, eyelids, blepharospasm, face, limbs, or trunk. Other common symptoms include tremor, rigidity, slowness of movement, bradykinesia, and difficulty with coordination. Importantly, unlike other forms of dystonia, autoimmune dystonia may also present with other neurological symptoms indicating a broader autoimmune process, such as cognitive impairment, seizures, or psychiatric manifestations. The rapid onset and progression of symptoms can also be a red flag, differentiating it from other types of dystonia. Diagnosing autoimmune dystonia can be a complex and lengthy process. There is no single definitive test, and the diagnosis often relies on a combination of clinical evaluation, neurological examination, and laboratory investigations. The diagnostic workup typically includes blood tests to detect the presence of autoantibodies associated with neurological disorders, such as anti-basal ganglia antibodies. Cerebrospinal fluid analysis may also be performed to look for signs of inflammation or immune activity within the central nervous system. Neuroimaging studies, such as MRI of the brain, can help rule out other structural causes of dystonia. However, in many cases of autoimmune dystonia, the brain MRI may appear normal. Response to immunomodulatory therapies can sometimes support the diagnosis retrospectively. Given the rarity and complexity of the condition, consultation with a neurologist with expertise in movement disorders and neuroimmunology is essential. While autoimmune dystonia doesn't have rigid classifications, it's helpful to consider it in terms of primary versus secondary, associated with another autoimmune disorder, and generalized versus focal dystonia, which defines the regions of the body affected. Recognizing these distinctions can inform treatment strategies and management approaches. The treatment of autoimmune dystonia aims to reduce the severity of symptoms, control the autoimmune response, and improve quality of life. Immunomodulatory therapies are the cornerstone of treatment, including corticosteroids, intravenous immunoglobulin (IVIG), plasma exchange, and immunosuppressant medications. These treatments work by suppressing the immune system and reducing inflammation in the brain. Symptomatic treatment may include medications commonly used for dystonia, such as botulinum toxin injections, anticholinergic drugs, and muscle relaxants. Deep brain stimulation (DBSS) may be considered in some cases where medical therapies are not effective. Physical therapy, occupational therapy, and speech therapy can also play an important role in managing symptoms and improving functional abilities. A multidisciplinary approach involving neurologists, immunologists, and other healthcare professionals is crucial for optimal management. Currently, there are no proven methods to prevent autoimmune dystonia. Given that the exact causes are not fully understood, preventive strategies remain elusive. However, maintaining a healthy immune system through a balanced diet, regular exercise, and stress management may be beneficial. Avoiding known triggers of autoimmune reactions, such as certain infections or environmental toxins, may also be helpful. Individuals with a family history of autoimmune disorders should be particularly vigilant and consult with their healthcare providers if they develop any concerning neurological symptoms. The prognosis of autoimmune dystonia can vary considerably depending on the severity of the condition, the timeliness of diagnosis, and the effectiveness of treatment. Early diagnosis and prompt initiation of immunomodulatory therapies can improve outcomes and prevent long-term neurological damage. Some individuals may experience significant improvement in their symptoms with treatment, while others may have a more chronic and progressive course. Ongoing research is focused on identifying novel therapeutic targets and developing more effective treatments for autoimmune dystonia. Areas of active investigation include the development of targeted immunotherapies, such as monoclonal antibodies, to selectively block the autoimmune response. Advances in neuroimaging and biomarker research are also helping to improve early diagnosis and monitoring of treatment response. With continued research and advances in clinical care, the outlook for individuals with autoimmune dystonia is gradually improving.